testing is only half the answer. In Germany, and almost every country that's successfully contained COVID, it's about tracing everyone who might be infected. And this is the model that we're now putting our faith in.
The way this works in a community is anyone who tests positive here in Germany, they're phoned and they're asked who they've been in contact with. Those contacts are then asked to isolate. Bit by bit, the disease is chased out of the city.
Guten Tag, Jedin Hong, mein Name vom Gesundheitsamt Rhein-Neckar-Kreis. Sie wurden uns ermittelt als Kontaktperson von einem bestätigten Corona-Fall.
They've been contact tracing since the start of the outbreak. It's run by the local public health authority.
We track down people who've gotten contact without knowing that they have gotten a contact to the coronavirus. So we were trying to close it down.
Das heißt, in Ihrem Fall wird dann die Quarantäne von letzten Kontakt, also von gestern, von Montag, 22.
Vorletzten Sonntag war ihr letzter.
And the tracers keep in touch to make sure everyone potentially touched by the disease is identified.
We're asking. It's like a little bit of Sherlock Holmes situation. You know, we've been detectives. It takes a lot of patience to ask on the telephone, where have you been the last day? Where have you been 2 days before? And so we've been able to find, let's say, one patient, about 10 people, contact people.
What has test and trace done for this community?
I think it's saved lives. It's saved maybe a lot of lives.
Tracing allows us to see how the disease is spreading through our communities. But with the phone app now delayed, do we have a strong enough system in place?
We will have a test, track and trace operation that will be world-beating, and yes, it will be in place. It will be in place by June the 1st.
England's new tracing system has only been running for a month. It's in two parts. There are existing teams of local public health experts who work on the bigger outbreaks in places like schools and care homes. And then there are 25,000 new contact tracers working from home. Most are low paid and working for private companies. They're supported by staff with medical experience.
So prior to today, I have had 0 cases. Absolutely 0, none at all. And I've done approximately 2 to 3 shifts per week. I feel guilty for being paid to do nothing.
The workers we spoke to didn't want to be identified because they could lose their jobs.
The majority of the days that I have worked, I have not had any contacts to trace at all. At first I thought that I was doing something wrong, and I've joined some help groups on social media, and other staff are saying the same. They're reassuring me that it's the same for everybody.
Me sitting here, clicking refresh, and I'll do that now, clicking refresh, nothing. There are no cases for me to do. No, absolutely nothing.
But the government says it's built a new service on a scale never seen before, and having an overcapacity is a real success. It's already helped to stop more than 100,000 people from unknowingly spreading the virus. So what's going on? How can the new tracing system have contacted that many people if the call handlers say they're hardly speaking to anyone?
But the government's figures weren't just for call centre workers. They also include cases that were being managed by professional teams on the ground. And it's these public health experts that are responsible for identifying and tracing most of the contacts.
So it's not the government's 25,000 new recruits. The most recent figures show 113,000 contacts traced. But if you dig into the detail, you find that only 15,000 of those were traced by the expensive new call centre. The vast majority were contacted by just 870 staff in the public health teams.
It was a surprisingly positive result. We thought, great, at last, maybe that they're getting to grips with this. So then to discover that actually this was largely down to the work that was already going on in the background, I do find that very disappointing. I think the government, weren't clear about that, and the public have been misled.
It's hardly surprising the new call handlers have nothing to do. In the first 3 weeks of the scheme, on average, they've had less than one successful contact call each. That matters because almost a quarter of people who test positive for COVID are still not being reached at all.
We've got to get it right. This cannot just be swept under the carpet. We need this to work now.
It's really surprising when you see the politicians at the briefing saying how well the contact tracing service is going, because the people that are actually working for the service know that that's not true. Absolutely not true.
Right now, keeping the disease in check is the difference between life and death. Thousands of lives are at risk if test and trace doesn't work.
Fighting against the pandemic situations means you have to know who has a disease. If you do not know, you're running behind all the time.
With less than 10% of our population having been infected, I think the maths are quite clear in my mind that the stakes are very high indeed.
Our fight against this killer disease depends on finally getting testing